You're going to do an introduction, and then Olarik is giving his presentation. Yes. Do we have the discussion of that presentation immediately or at the end of the session?
End of all the speakers, because then if the YouTube people decides just to cut the program into just a short speakers, then we have the speakers without the Q&A. But the Q&A is always a very interesting part, and I hope the audience will ask questions and not send greetings to each other. And then you know it's very difficult for me as a chairperson to read 100 greetings. Hello, Hugo. Hello, Antonio. Hello, this and that. So and then I have to go through 10 of this to find a question. So the best is if anybody wants to ask a question, just raise your hand and indicate. I can see you, or just say something.
Good.
And
I raised my hand, Professor Lee. Did you hear me before?
Sorry, I can't see anybody now. Just a moment. Oh, okay. Raymond, if you can hear me, Raymond, okay, you know, after the last episode, Hugo was making a lot of noise and say that he was not given a chance.
No.
Oh, I that, you know. So Raymond, please stay on. He's going to ask you, be the first person to ask you the questions during Q&A.
So at the end of the session, huh?
At the end of the speech, so that we don't interrupt the flow, huh? Okay.
Okay.
Hey Raymond, how are you? This is
Hugo. All right, thanks yourself.
Yeah. So I had a very important question to you, but we do that at the end of the session. Is that okay for you?
Yeah, that's fine.
Yeah. So there he is. Yeah. So I think you remember I'm Belgian. So yes. We had always, between South Africa and Belgium, we had a very good relationship. And I went 25 times to South Africa. My dear friends died now. Johan van der Wat, who died. I'm still very sad about that. But okay, I think we need to start with the live session. I talk to you later. Bye, Raymond.
Bye.
Okay. All right. Thank you, everybody. Welcome to the last of the series on APAGE-ISMIVS HIFU. This is episode 4, and my co-chairperson is Dr. Aili, and my panelist is Dr. Hugo and Professor Friedrich Gill from Austria. I'm Dr. Lee, the founding member of APAGE, so I'll be your chairman for this last episode. Now, all in all, we have 4 webinars on uterine fibroids and adenomyosis. We already completed 3 webinars, and today is the last of the webinars. I have all in all 20 experts and 1 mystery guest, and the mystery guest will be with us today. So somebody has to remind the mystery guest. My co-chairperson all the way from Surabaya is Dr. Aili Yunariri, and he works in Department of OB/GYN of Dr. Sutomo General Hospital, and also at the Medical School of Airlangga University, Surabaya, Indonesia. He is a professional member of Indonesian Gynecology Endoscopy Society, AIH. He's also a member of the Asian Pacific Association of Gynae Endoscopy, APAGE, and he's also a member of on uterine fibroids and adenomyosis. We already completed 3 webinars, and today is the last of the webinars. I have all in all 20 experts and 1 mystery guest, and the mystery guest will be with us today. So somebody has to remind the mystery guest. My co-chairperson all the way from Surabaya is Dr. Aili Yunariri, and he works in Department of OB/GYN of Dr. Sutomo General Hospital, and also at the Medical School of Airlangga University, Surabaya, Indonesia. He is a professional member of Indonesian Gynecology Endoscopy Society, AIH. He's also a member of the Asian Pacific Association of Gynae Endoscopy. I really don't know what happened. Looks like somebody has recorded my introduction and playback at the same time. So, okay, let me explain. All of you are all over the world. I'm in Singapore as the chairperson, but the control center is in Chongqing. So can we have some understanding that sometimes errors like this can crop up, technical issues like this can cause. Let me finish. Rally is the chairman of Fertility, Endocrinology, Reproduction Division of Department of OBGYN of Dr. Sutomo General Hospital, Medical School of Erlangga, University of Surabaya, Indonesia. He's also the chairman of Indonesian Permanent Contraception Organization, and he's also the endoscopy task force of Indonesian ONG Association, and very proud, he's the chairman of the 19th APAGE Congress at Surabaya. I'm very happy to show you my next slide. Okay, this is one slide I cherish a lot because it shows here, Rally is the organizing chairperson with all my friends with a picture taken in front of the stage at the 19th Asia Pacific Association of Gynecology Endoscopy. I'm also happy to say this was the first official scientific program where HIFU is introduced. So this is the first time officially APAGE heard about HIFU. And thanks to Professor Lee Chilong for accepting the scientific program of HIFU. Okay, my good friend here, Professor Hugo Verhoeven, he's the Medical Director of Private Center for Endocrinology, Reproductive and Preventive Medicine, Düsseldorf, Germany. He's the chairman of ESGE Working Group on Non-Surgical Ablative Therapy of Benign Uterine Disease. So it's a very important person, and we have him to thank for becoming a liaison of Asia and Europe again. Why do I say that? Because Germany is famous for beer and all the beautiful ladies, and that's we met up again in this picture after many years. He has disappeared from the scene, and then we met up in China, and we had a very nice discussion with the group of friends from Taipei, Professor Li Qilong, and also Wang Zipiao, Rosie, and Ping in an informal setting. And this one. Well, you know, when you talk to Hugo about anything, he's an expert on it. And even at dinner at the dinner in the seafood restaurant, he would talk to me about how to do a laparoscopy on a crab. So that's Hugo for you people. And I'm glad I met Professor Friedrich Gill, and you would notice there's this Mr. in front, and I guess Professor Gill probably has a surgical or general surgical degree as well. He's a medical director of Medical Center Margareten, Vienna, Austria, and head of IVF Clinic Baden, Austria. He's a member of the working group on non-surgical ablative therapy of benign uterine disease. So he works very well with Professor Hugo. And I know he has successfully finished the first laparoscopic hysterectomy in Austria and the second in Europe back in the year 1993. Now, when I got off the plane and stepped onto the ground of Austria, and you know, Austria is really the sound of music, and the culture is all very musical, and people are very pleasant, and that is Professor Friedrich Gill. Now, today, I've introduced my co-chairperson, my panelists, and very important, the speakers. All the way from Bangkok is Dr. Olarik, and all the way from Shanghai is is Professor Aixingzi Aili, very elegant lady. So I would like to say this whole series is organized to introduce HIFU, and I believe this procedure will change the practice of gynecology and adds a new dimension to the treatment of uterine fibroids and adenomyosis. This is a virtual knife, and this is where the invisible knife comes up from the bow below. Okay, I've noticed the special guest is in the audience now. I would like to tell a little story and introduce someone special. You know, long ago, physicians likes to listen to the heart sounds and the chest sounds with the ear to the body. and obstetricians, gynecologists will examine the pelvis of a lady in the Victorian era in such a manner. Dr. Lynette was the first physician to use a tube to listen to chest sounds. From what looks like a tube to what looks like the stethoscope we have, which you use nowadays, it took 132 years. And in 1988, Professor Wang sets up the research team on HIFU applications in Chongqing. And in year 2000, HIFU was approved by Chinese authority for the treatment of tumors, both benign and both cancerous. This is a picture of Professor Wang Zibiao. And notice he took just from 1988 to year 2000, just 12 years to transform what I call a heavenly knife to something that mankind can use for the benefit of our patients. And I think you have seen this picture many times. Do you notice that there's always a very quiet person, gentleman sitting in one corner? Well, he's one person who doesn't like the limelight. He's always in the laboratory and always working. And that is Professor Wang Zibiao. He's actually the founder and the inventor of the present day HIFU knife, but he's a very humble person. We are fortunate today we managed to encourage him and say a few words. Professor Wang Zibiao, who is the inventor of ultrasound HIFU of Chongqing. So maybe Chongqing, over to you. Can you get Professor Wang Zibiao online to meet us?
Hello. So Professor Wang will talk in Chinese and I will interpret it into English. Thanks a lot, Professor Lee, and hello, Hugo. You can hear us?
Yes.
Okay.
Yes, very good. Thank you.
Thank you. 今天很高兴啊，参加我们亚太这个腔镜协会里面专门就是对腺肌症的微复创、腺肌症的聚焦超声治疗的这个专题会议。
And today I'm very happy to join this webinar, a webinar about adenomyosis, which is co-organized by APAGE and ISMIVS. It will focus on the minimally invasive treatment and the HIFU treatment of adenomyosis.
这个经过了这个疫情呢，今天看到李教授，看到胡格教授，很高兴。这个会议我也相信，在这个疫情期里面，还没有完全解决这个世界的疫情期里面办这个会，我相信也是从另一个更阳光的角度，这个更健康的角度来面对这个今天这个世界。
Okay, so it's very happy to meet friends like Dr. Lee, Hugo in such condition, the COVID-19 situation. And we think that we organize this webinar in such condition. It's like we bring some light into the doom sky to make it brighter.
我这儿要跟大家汇报两个消息。第一个消息就是上个月，中国正好这个就子宫腺肌病呢、腺肌症，专门这个在腺肌症的专家共识里面，已经把聚焦超声写进了这个共识里面。这是第一个消息。
I have two news to share with you today. So first one is last month in June. The HIFU treatment of adenomyosis was included in the Chinese experts consensus.
而且正式4月7号发表在中华医学杂志上，这是中国的医学的最顶级杂志。
And it will be published in the Chinese Medical Doctor Journal soon. 10月份是吧？
不
in June. It has already been published in the journal.
Yeah.
It is one of the top journal in China.
而且4月份，李建威教授也参加的，包括这个安山达教院士也参加的，这个中国医师协会 也在这妇产科的刚刚是最顶级，也在中国那个中华医学杂志上发表了整个聚焦超声的共识。
Okay.
技术共识。
In this year in April, we also have published the guidelines about the HIFU treatment of uterine fibroids in China.
其他肿瘤、恶性肿瘤也同时发布技术规范。
Also included other malignant tumors.
是的。第二个消息就是在预行期啊，3月份，这个中国政府批准了一个国家重点实验室。这个国家重点实验室的名称叫超声医学工程国家重点实验室。那么这个批给了我们重庆。
And another news is about the state key lab of national state key lab of medical engineering ultrasound medicine, which was approved by the Chinese government. This lab was belongs to Chongqing Medical University.
那么这在中国也是唯一的一个这个领域唯一的一个。
This is the only one in this field.
所以我在此时此刻是感谢大家。由于我们李教授，整个亚太这些教授们的工作，那么让我们拿到国家的重点实验室，也感谢 Hugo 我们欧洲的这些团队的工作，所以这是一个整体的，这个荣誉属于大家。
I would like to take this opportunity to extend my gratitude to all the experts who have contributed to this, such as Dr. Lee and Hugo. I think this honor belongs to everyone, not just only us.
当然，我更希望啊，今后在这个国中建设里面，有各位教授的智慧和辛勤的劳动。
And I hope in the future you will help us also devoted into the construction of this lab to make it better.
好的，我今天主要也跟大家打打招呼。好，希望大家这次会议预祝今天的这个线上会议成功。谢谢大家。
This is what I want to see, and I hope this webinar will be successful. And thanks a lot.
Thank you.
Thank you. 谢谢，谢谢，
谢
谢谢王教授，谢谢。
好。
Okay, thank you very much. And we move on. Because Professor Wang has another meeting to attend. Again, this is brought to you by the two organizing societies, APAGE and ISMIVS. Again, APAGE stands for Asia Pacific Association of Gynecology Endoscopy, founded in 2003. Let's take a walk down memory lane. A picture which I've shown before, the founding members are in this picture, and you have Professor Li Qilong and President-elect Prashant and Harry Rich. And what I want to show is the picture taken in 2003, and you can look at how different this man, his name is called Hugo Verhoeven, how different he is from today. This is President of ISMIVS, Professor David Cranston, Oxford University. We have him to thank because his group actually helped us to introduce HIFU into the curriculum of NICE guidelines. This is the board. Right now, ISMIVS is the old name. It is called ISMIVS. And whenever ISMIVS has a meeting, it's always thousands and thousands of people. These are pictures of all the audience, and I noticed friends from Somchai, Vira, Felix Wong, and of course Antonio is behind from Spain. And this is perhaps the most important picture I want to show, where the two organizations signed MOU to cover HIFU training and education, research, and very important certification, because HIFU is not as simple as it seems to be, like pressing a few buttons. It is really a whole package of engineering, discipline, management, and preceptorship. So that's why certification is important to protect the patient and also to protect the organization that is moving into HIFU practice. There are two different versions of therapeutic HIFU. One is the MRI-guided thermal HIFU, and the other one, which is we are talking about for the past 2 months, is ultrasound-guided HIFU, which gives you the ablative power the ablative capacity. Until December 2018, ultrasound-guided HIFU has been used for more than 26 countries and regions, and then 120 cases has been done, compared to just 4,000 cases in MRI-guided HIFU. And I just got the quick calculations, which means there will probably be about 6,000 cases of ultrasound-guided HIFU done every year compared to 200 cases of MRI-guided HIFU done annually. So that's the difference. Okay, the main difference, since this is the last episode, I will dwell on it a little more. Of course, anatomical resolution is superior in MRI-guided HIFU compared to ultrasound. In MRI-guided HIFU, they use monitoring as the deciding factor of how much sonication to be delivered, whereas in ultrasound-guided HIFU is really live, real time. The transducer movement of the MRI-guided HIFU is limited because it's in the MRI machine. As all of you can imagine, once you're in the chamber, in a tunnel, there's not much movement you can do. Patient positioning, again, because it's in a tunnel, you cannot move the patient much. In fact, you have to tell the patient to keep still. Because of that, treatment time in MRI-guided HIFU takes longer compared to ultrasound-guided HIFU. Treatment efficiency, now MPV stands for how much treatment efficiency you can deliver. It's usually about 20 to 50%, but if you want to have good treatment results, you need to have an MPV of over 70%. So ultrasound-guided HIFU gives you an MPV of 80 to 90%. Also, in MRI-guided HIFU, we have to trouble our radiologists because they are the one actually operating the machine, and MRI machines are very expensive. A lot of people are waiting to use it, whereas in ultrasound-guided HIFU, we just need the MRI-guided image to be mounted in the machine, and any gynecologist or trained doctor can operate the machine. So just to recap, MRI-guided HIFU is not real-time. It takes 12 to 30 seconds of sonication. In other words, when you press the button, it's 12 to 30 seconds of energy delivered to the patient continuously. And you know how long is 12 to 30 seconds? If you sing happy birthday, it's like singing the happy birthday clause twice. And then you have to have 90 seconds of cooling, and you hope, keeping your fingers crossed, that the bowel does not move into the line of fire to the uterine fibroid. So whereas in ultrasound-guided HIFU, it is ablative in nature, the procedure can be done by gynecologists, surgeon, or radiologist, or any trained doctor. The duration of ultrasound-guided HIFU procedure is independent of the MRI machine. So the MRI machine can be put to better use for the other colleagues in the same hospital or in the same setting. Now, I will invite my co-chairperson, Dr. Aili, to introduce Dr. Olarik, and then we have Dr. Olarik to give the lecture. So over to you, Dr. Aili.
Yeah, thank you. Just a moment. Thank you, Dr. Kim, for your very, very nice introduction for us, and we're very glad we can join again with our webinar. So I want to introduce this first speaker. Is Dr. Olarik, is our friends from Thailand. He is Dr. Olarik is work in the Chopaya APAGE-ISMIVS Hospital. Sorry, my pronunciation is not so good for Thailand spelling. His area of interest is reproductive medicine, gynecology endoscopy, clinical research epidemiology, and health technology startup. And since 2016 until now, he was his social media team of American Society of Gynecology Laparoscopy. And 2018 until now, he's assistant director for lecturer and research affair of Medical Education Center. And 2019 until now, He's a chairman of Subcommittee Continuing Professional Development, the Royal Thai College of Obstetricians and Gynaecologists. And 2019 until now, also, is a Subcommittee of Reproductive Medicine and Subcommittee Gynaecology, the Royal Thai College of Obstetricians and Gynaecologists. So it's time to you, Dr. Olarik, for your presentation, please.
Thank you, Chairman and Co-Chairman. Thank you for having me here. Good evening in Thailand time, and maybe good afternoon in Europe, right? Good afternoon in Nigeria. We have our friend from Nigeria and South Africa. Okay, I would like to share my slide. Let me check. Okay, can you see my slide?
Yes.
Yeah.
Okay. Okay. So today I will talk about the adenomyosis, tip of the iceberg in infertility. Okay, and this is my hospital. Can you see my hospital?
Ooh, looks like a palace.
Yes. It's like it's an old palace. It's 110 years old already. Professor Hugo already visit our hospital. Okay. Okay, so and please feel free to contact me via the WeChat, because I know today we have a lot of the audience from China. You can save my presentation also. Okay, and for the disclaimer, I don't have anything to disclaim. Okay, the outline today is I will talk only two topics. Okay, evidence base of adenomyosis and infertility. And the second one is experience base of adenomyosis and infertility, because Professor Lee, he's talked to me that we want to like a panel discussion. We want to know about the experience, not only the lecture. Okay. So what about the evidence base of adenomyosis and infertility? I think all of us know the type of the endometriosis. Now we have 4 types of the endometriosis. The first one is a peritoneal endometriosis, that the lesion is on the peritoneal cavity. The second one is endometrioma. It means the endometriosis at the ovary, even one side or both sides is endometrioma. The third one, and I think this is very difficult for the surgeon, I mean for the gynecologic laparoscopy to do, is deep endometriosis. The definition is not really clear, but some literature said deep endometriosis is endometriosis lesion is deeper than 5 millimeters. And the fourth one is this. Is this a nightmare of the infertility treatment? It is the adenomyosis. Okay, so how it happened? This is the good picture for the theory of the endometriosis. The first one is very famous. It is Samson theory. It is a retrograde reflux of an implantation of the endometriosis tissue. Okay, the second one is early embryonic development of the lesion, and the third one is in situ metaplasia development. Why we have 3 theories? Because now we know that only one theory cannot explain how the endometriosis is occur, and this is the endometriosis. I will show the theory of the adenomyosis, because now we know that maybe adenomyosis have the different pathophysiology of the endometriosis. This is the literature from my good friend Sylvia. He published about 2 years ago. It is about the theory of the pathophysiology of adenomyosis. Is it the invasion of the endometrium to the myometrium tissue? And there is a tissue injury and repair. Repeat lipid. Okay, after that there is some proliferation and fibrosis, and also there is abnormal sexual receptor. We know that in endometriosis there is increase of estrogen receptor, and there is a downregulate of progesterone receptor, and there is also the inflammation of the tissue, and there is a neuroangiogenesis. That's why the lesion can grow by itself. And this is the another good theory. Now we have a theory about adenomyosis. The first one is invagination from the endometrium to myometrium. This is the first one. The second one is that there is a stem cell in myometrium, and there is a new growth, or we call the de novo, in myometrium tissue. And the third one is invagination from the outside. Professor Chapon showed the data that there is a correlation between DIE and endometrial and adenomyosis, because the DIE will infiltrate from the outside to the posterior wall of the myometrium or the uterus. And he showed the data that show there is invagination from the bladder endometriosis to the anterior wall of the uterus. By the way, we know that only one theory that cannot explain. So why we have the three theory? Okay, and how we diagnose the adenomyosis. And now we don't have the clear statement how to diagnose the adenomyosis, only the histology after we do the hysterectomy. But how about the imaging? There are a lot of the school want to describe how to diagnose the adenomyosis. But I think this is very good one and very easy to understand. We call that this is MUSA, morphological uterus sonographic assessment. We have around 3 types that we can looking by the ultrasound. The first one is line and birth. The second one is echogenic Iceland. The third one is the cyst. And after that, if the disease is progressed, we can see the irregular of the junctional zone. We can find the fine shape of shadowing. Someone said it's like a moose head, something like that. And the indirect side is a globular shape of the uterus and asymmetrical thickness of the uterine wall. Okay, and this is, I think, is very, very important that we need to know and we need to do. It is about how we describe the adenomyosis or how to report the adenomyosis, because the location of the adenomyosis, the site of the adenomyosis is affected to the infertility treatment. I think it's same as the myoma. Now we have the physical classification of the myomas 8 type. We have to describe type 1, type 0, type 2, because the location, the site is affected on infertility. And now this I show you this type of the adenomyosis. The location, focal or deep field, is it a cystic or is a layer extend the size? This is very important. Okay, so we know that adenomyosis and endometriosis associated pain. The woman will have the dysmenorrhea, dyschezia, and also dyspareunia. Dyspareunia is very, very important, but because if the woman have the dyspareunia, she can not have sex. So if she don't have sex, how to have the baby? Okay, so this is very, very important. And how the endometriosis and adenomyosis affect the infertility. There is some data. Let's talk about the sex and endometriosis. There's the data nearly 50% suffer from painful sex if they have the endometriosis. Okay, and this is the pathophysiology and of the endometriosis. Its effect of the uterus, its affect uterus, it affect peritoneum cavity and also the ovary. I don't have time to tell you the detail how it affect the infertility, but I think you can discuss after this. Okay, this is why endometrioma affect the infertility. There is a very, very special molecule study how it affect. Okay, it's not only about the infertility, but its effect on the reproductive outcome. There's the data show the increased rate of spontaneous miscarriage in endometriosis, and also have the adverse effect on the preeclampsia, on the placenta malposition. You can see most of the outcome is statistically significant. Spontaneous abortion, PIS, I mean the preeclampsia, gestational hypertension, chronic hypertension, GDM, fetal malpresentation, and also the preterm delivery. And some studies say that there is an effect on the SGA, small for gestational age. And how we manage the adenomyosis. This is the basic treatment. The first one is expectant. The second one is medical treatment. I mean, we can use the GnRH agonist, we can use the progestin, we can use the aromatase inhibitor. I will tell you after this. We have the surgery, radical surgery, conservative surgery. That's sure for in our field for the infertility treatment, we cannot do the radical surgery, except the lesion or the disease is very severe. We have to radical surgery and then go to use the surrogacy. And another treatment is uterine embolization, and I think Professor Aili, she will talk about the HIFU. Okay, what is the role of the medical treatment in management of adenomyosis? We have a lot of the data that the medication is very, very effective treatment for the adenomyosis, for pain, for abnormal uterine bleeding, but not for infertility treatment. Okay, this table is very clear to show that the mechanism of the action of the GnRH agonist, when you inject to the patient, she will go to the hypoestrogenic state. So that's why the disease is improved. The progestin, we have a lot of type. The progestin, we can use the MPA, we can use the dianogest that can treat pain. Abnormal uterine bleeding is very good, but not for infertility treatment. LNGIUS, we use the levonorgestrel IUD put inside the uterus. And after that, there is no bleeding or the bleeding is decreased. But we know that it is a contraception, right? And COC, the mechanism is a decellulite and a subsequent atrophy of the endometrium. And we know that it's a contraception pill. Okay, the NSAID is very good for the pain, but there's some data that the NSAID, when you give to the patient, there is no ovulation, there's no rupture of the oocyte. So most of the medical treatment that not give the benefit for the infertility treatment. Except the GnRH agonist, we have a lot of the data that for the long protocol, we give GnRH agonist before the treatment of the IVF. Okay, sometimes there's a pregnancy rate is increased, but we need more data. Okay, so how about my experience based on the adenomyosis and infertility? And for this year, I am the chairman of the ASIM SIMSIC. What is the SIMSIC? SIMSIC is a complementary and integrative medicine special interest group. That means I use everything for my patient to get pregnant. This is the definition from the USA about integrative health. What is the integrative health? It's a conventional plus complementary approach to make the patient better. Holistic approach, patient focus, wellness, mental, emotional, functional, spiritual, social, and community aspect. We look for the whole person. Because of infertility, we treat the patient. We not treat only the disease. Most of the infertile couple, they have a psychological problem. They suffer that they cannot have the baby. And now they suffer, they have the disease like adenomyosis, endometriosis. The women have a pain, have a dyspareunia. So we have to look for the whole person, not only the adenomyosis. This is my experience. Even the patient cannot preg by herself. They can use the surrogacy. We not treat the adenomyosis, but we treat the infertility for them. Okay, this is the option. So the most important thing I think is infertility treatment care plan. This is my picture during the COVID-19. Now in Thailand, we don't have a new case for almost 2 years. Most of the new case, they're from abroad and stay in the state quarantine. This is a new normal. I have to wear the eyeglass. I have to wear the mask all the time. I have to use the telemedicine to talk to the patient. Okay, and sometimes I use the PPE to do the operation. Okay, in my experience, when I treat the adenomyosis and infertility, most of my patients, they have combined. It's not solely adenomyosis, but mostly combined with endometriosis and pelvic adhesion. So I do a lot of the laparoscope. And this is the robotic acid machine in my hospital. So I'm a solo surgeon. My nurse, she can sit outside the operation room to wait for my operation. You can see this is a voice control. It's very good, and my nurse love it. Okay, and this is okay. This is my diagram when I see the patient who have the adenomyosis and endometrioma. Mostly, I do the operation because my patient have a pain, my patient have a dyschezia, so I do the operation. After that, I will allow them to natural pregnancy or do the IUI. But after our plan, if not success by the natural or the IUI, I will send the patient to do the IVF. Okay, this is my diagram. And thank you. So we have more time to discuss, and please feel free to contact me personally. You can save my WeChat. Okay, thank you.
Hey, thank you. Thank you, Olarik.
Thank you, Dr. Olarik.
Thank you. We'll leave the question and answers to the end. Okay, next. Let me share my slides. Okay, next we have the very elegant Professor Aixingzi Aili, all the way from Shanghai. She's the head of HIFU unit, the first affiliated maternity and infant hospital of Tongji University. She's the deputy director of the endometriosis group under the Shanghai Medical Association of Obstetrics and Gynecology. She's a member of the minimally invasive and non-invasive medicine committee under Chinese Medical Doctor Association. She's honored as the Woman Pace Setter of Pudong District in the year 2013 and 2014. Also acknowledged as one of the top 10 angels of maternity and infant care in the year 2016 and 2017. Now, as far as I know, HIFU is the spring of the sufferers of adenomyosis, and in Mandarin, 海服是妇女的春天，但是我觉得海服
是腺肌病的春天。
腺肌病的春天 ，OK， 对不起啊。哦，但是我觉得你是你的医院的春天，因为为什么你把那个海服刀已经推广的很多妇女都接受，所以很多妇女就排着队所以来看你，更谢谢你。
Yeah, it's true.
Okay. Well, this is a picture taken when I first met her in China, and her topic today is on HIFU experience in Shanghai First Maternity and Infant Hospital. So let's have Professor Aixingzi Aili to share her slide. Aixingzi, please, over to you.
Okay. Can you see my slide?
可以看得到。
Okay. 好的，好的。Good evening for all friends. Under the night sky, like in China, outside is dark. Good morning for the friends still under early sunshine. And good afternoon for some friends, maybe just noontime. I am so appreciate the invitation from Professor Lee, who is one of my big teacher, also my brother. Furthermore, a karaoke singing friend. Maybe some of friends know he is a very wonderful singer. Although we are at different time in different country, but I believe we came together having seen big heart for creating patients beautiful life, healthy life. Am I right, Professor Lee? 我说对哦。
夸张了。
就是我们在一起要做更好的事。So it's my great honor to be here to introduce some of HIFU experience about adenomyosis in our hospital. So firstly, here is a picture. I'm here in China. This is a beautiful Shanghai. Olarik, you are the very, very old friend of ours. I saw him in Shanghai many times. He is a very positive traveler. Everywhere, he can go everywhere. Very nice. And this is nearby our hospital, also my home. This is our hospital, was built in 1947. I am sitting in this building at the front. And we have a long history also. We have two parts, Eastern and the Western campus. I am sitting in the 东院，应该是 Eastern part. Professor Lee came to our hospital last year. So my hospital had many achievements for National Nature Science Foundation of China. So we can see here our hospital in the #1 from 2007. So here's some research we will pass. We have big team for obstetrical team. So this is Tony. Maybe some of the friends know him. Our hospital in China is a number many years in the top 1 for delivery. Every year nearly more than 3万的话应该是 30,000. Here is our gynecological team. We have a very tough and big Professor Wan Xiaoping. He has a very huge ambition. He wants to create the best women's hospital in whole China. So for HIFU, our hospital said we are the #1, but I am not think so. Here's some research center. So we will pass this. So up to now, we will see all around the world already have 27 countries have HIFU center. We are here, the red color. So Olarik, do you have HIFU? Olarik, you have HIFU now.
Not
So
yet,
here,
not yet.
yeah, you will have very soon and you will like it. So here on the left picture, we will see in all China, everywhere have already. So right side is also the picture. It's like a beautiful bowling firework. So everywhere the HIFU here. So this is a very huge telemedicine center. So every case is we done, we will connect with Chongqing, and we have many good friends. They will monitor our cases just in case for the patient safety. So here we can see that in whole China, we are in the third level. So we will see like Professor Xue Ming, Professor He Jia, she is the president of the hospital, very, very wonderful lady. And the two hospitals, the year cases already beyond 100 cases. For us, we are in the third level, so every year we nearly done 500 cases. Actually, we beginning from zero, so it's sometimes it's not easy. Beginning from 0 to 1,000, we created in 2018. So I want to use a very famous professor during the coronavirus era in China, the big professor Zhong Nanshan, and he said choosing medicine may be an accident. So our team said we choosing HIFU may be an accident, but once we choose this, we will keep a very huge enthusiasm moving on. We beginning from 2050, so we will say we are gradually grown up year by year. Up to now, we already finished 1,550 cases total. Mostly we done is adenomyosis and
myoma. Yeah. We lost the sound. Sorry, I think we lost the sound. Professor Aili, we lost you. We cannot hear you.
Connection problem, I think.
So now she left, right?
This, I think so, because she's not sharing the slide anymore. Let's see what's going to happen to, can somebody from Chongqing, Jenny or somebody tell us what's happening?
I think it's some problem with the internet. So they are trying to solve the problem right now.
Okay, then. I mean, if that's the time that they are trying to solve the problem, I was thinking, shall we just go on to the question and answer? Because I think on standby is Dr. Raymond and Dr. Professor Hugo has a question to ask Raymond, and he purposely...
Okay, she's coming. Aili is coming.
All right.
I think she's back. Okay. Perfect.
Yeah.
Not yet. Oh. Professor Lee?
Yes, I'm here.
Yeah. Shall I use those 1-2 minutes?
We use this time. I think we use this time to for you to discuss with Dr. Raymond.
Raymond, yeah.
So you go ahead. I know if you don't talk to Raymond and Raymond doesn't join the meeting, you're going to drop an atomic bomb on me. So please carry on. Raymond.
No.
Okay, carry on, please.
Raymond, can you hear me?
Yes, I can hear you. Can you hear me?
Yes.
Yeah, very good, very good. Well, last or 2 weeks ago, I enjoyed very, very much your talk about your work in Soweto Hospital. And I was really very surprised that you told us that your team is 1 doctor and 3 nurses, and that you did 400 cases. This looks to me really amazing. How do you do that? Are you having next to you all the time somebody experienced in HIFU, or are you all the time connected with Chongqing? Because I, with all respect to you, I cannot imagine that you have no cases where you're coming into big problems. I know South Africa very good. I did 100,000 C-sections in South Africa on young women because you had so much. So how do you do that? Being in a Soweto hospital with 100,000 deliveries, and you are sitting there alone with 3 nurses doing the HIFU. How do you do that? That would interest me so much.
Yeah, so unfortunately we don't have internet connection with Chong. So basically, I'm just on my own.
Sorry, I checked many times already with Professor Lee. Everything is normal, so I'm not sure what's happened now.
Okay, I think等一下，他们在谈话。I'll come back to you in a moment.
We checked many times already.
Okay, just a moment. Just give me 5 minutes. They are discussing. We'll go back to Raymond.
再来，停止共享。
Okay, sure. Raymond, can you continue?
Yeah, so we don't have internet connection with Chongqing, so I can't really ask for advice from Chongqing. So we just make sure that we screen our patients very carefully. In cases that I think are going to be problematic, I'd rather not do them.
Okay, so you that is very amazing for me, because I know most of the your patients are disasters. Yeah, so I've never seen in my life patients with so extensive adenomyosis or myomas in young age as in South Africa. So I really admire you that you, as a self-made man, practically manage all those cases. And I would love to come over to you and to see how you do that, without connection with Chongqing. Once again, I would like to say I admire that, because my experience is very small, but I know from Professor Lee that after 100 cases, he has still somebody sitting next to him, and he is always connected with Chongqing, and that you can do that on your own. That is, Professor Lee,
yes,
you will agree with me, that is fantastic.
That's right. I think very much depends on your selection of cases. Maybe Raymond has a strict guidelines on what the cases can do. But okay, shall we go back to Aixingzi? We'll come back to the Q&A in a short moment. I think she's waiting in Shanghai for her. Okay, Professor Aixingzi, Aili, you can continue, please. We lost her again. This slide. So, Professor Aili, we still cannot hear you. We still cannot hear you.
Only ladies.
Hmm.
Oh no, there's one man.
No, we still cannot. No, okay. Well, since we cannot hear her, but let me just explain that. You see, we always think that we can select the easy cases, and once your doors open, all the solitary single fibroids and 5 cm, 6 cm, 7 cm will come to you. But in a private practice setting, it is not true. And I can tell you, Professor Felix Wong of Hong Kong has the same problem. So maybe Raymond has very strict criteria in selecting his cases. But in a private practice setting, you find that the moment they know you have a HIFU machine, I can tell you the worst of the cases are going to approach you first, because these are the cases who are in desperate need of treatment for their fibroids or adenomyosis, but they do not want to have a knife on the stomach. So they want to try out something which all the other colleagues are unable to perform, and they will come to your clinic to knock on your door and say, could you try HIFU on me? So in that sense, you always have to have somebody, a trainer sent by Chongqing to be with you, or you have this telemedicine advice all the way from Chongqing. The reason is, it is a machine, but the person deciding on how to operate on that invisible knife is still the art of surgery and the skill of surgery. A fibroid, a simple fibroid, 5 to 6 centimeters, can be anterior wall, can be fundal, and can be posterior wall. So you have to decide. The anterior wall, what would you do if the bladder doesn't push the bowel away? In the posterior wall, the same 5 cm fibroid looks easy, but you have to watch out for the nerves and the backbone and the sacrum behind, the coccyx behind, because any of this heat transmitted in the treatment of the posterior wall fibroid actually goes onto the backbone, goes onto the colon and the rectum. So we have to be very careful about it. And that's why the certification of HIFU practitioners and the centers are very important. And I stress this many times. If there's a case occurrence which is not good to the patient, or there's a complication, you don't look good because of one case, the rest of us in the whole world practicing HIFU will not look good. It's the same story that we had when we started 25 years ago on laparoscopy, so everybody will be laughing at that and say, you know, you guys are putting needles into the abdomen. What if you puncture the arteries, the vessels, and the stomach and the bladder, and so on and so forth. So, and that's why we have laparoscopy meetings, and we improve and we share our skill, our disappointments and complications we had before. So that's right. That's why, although after 100 cases, there will be very trying cases that comes with multiple fibroids, and you have to check, to select which one you're going to do first. And with this, the only people would have lots of tons and tons and tons of knowledge on this and experience on this is still Chongqing. And that's why I have the telemedicine center that helps the rest of us in the rest of the world with the HIFU machine. So I don't know, are you back on online?
No.
Aixingzi, Professor Aixingzi, are you back online? If not, then we continue with the rest of the webinar, and then we'll have her back online in a short while. Are there any questions from anybody at the moment for Olarik?
Professor Lee,
yes.
Professor Lee, may I just give a comment on what yes. you just said? I guarantee, I've been to South Africa many times, that Raymond has no easy cases. I think all the cases he explained 3 weeks ago that are all people with disaster who just say, I do not want surgery. So I admire him that he can manage to do HIFU without telemedicine communication in a setup in Soweto Hospital. And it's fantastic. So I congratulate him for that. And I'm sure he's doing a fantastic job and encouraged me, because the first cases I did, I was saying, oh my God, what is this? We'll never learn this. And so what he presented 2 weeks ago was for me a real encouragement to say, even with limited possibilities, you can do a good job. And I congratulate him for that. And that I wanted to say. Sorry for being so long.
No, it's okay. I agree with you wholeheartedly. There must be something that Raymond has, some experience, a different learning curve from the rest of us. And I do agree that there are different cases, and especially a lot of heavy ladies, which Raymond has told us about. But well, these things we can only learn when we go over to South Africa to visit him over a nice cup of coffee, tea, or simple dinner.
Let's go.
I will join you here, bro. So I hope Chongqing, please take note of our request, Chongqing. Is Aixingzi back back with us? Is Aixingzi back with us? Okay, if not, then we carry on with the. 听不到，我还听不到。Okay, the control center in Chongqing, can you please tell us what's happening?
Nothing is happening.
Can I just say something?
Sure.
I must have.
Oh, I can hear Aixingzi now.
He's back.
能听到我声音吗？
听得到，目前听得到。Raymond will come back to you, Raymond.
Very interesting， 这个不知道怎么回事情。
Okay， 听得到，现在看得到，听得到。
I did not do anything. I put my hand here, suddenly disappear and come back again.
Okay, all right.
Sorry, so I'm continue talking about the adenomyosis. Like already mentioned, we should treat patient integratively, medicine-like. So we're holding the spirit of human first, we build like a carrying uterus club. In Chinese is 爱宫俱乐部. So we treat patients not only adenomyosis, we treat patients integratively, whole family and infertility and everything. So we will say from this picture, Professor Li, 你可以看到这张照片吗？
我看得到。
Yes, at the front, in the middle is me, and the most 80% all my patients they, after HIFU. So this little girl say she permit I can show the picture. So I got permission. She has a very severe dyspareunia, and she also had a very severe depression after HIFU, and he changed a lot. So we can see from this picture, and he told me, like, he write many things to us. She sent the fit between patients and the doctors is so wonderful. So he feel very warm from us. And also, she mentioned to the other patients, managing emotion well is a very good medicine to overcome the disease. So we had the 1,000 cases, she delivery already. So we call it's like a milestone in our HIFU travel. So this is a cake here writing like to my team. So here's some flowers. So many friends can see from my WeChat, nearly every day I can get flowers from patients. So this is 1,000 cases baby, HIFU baby. So we have the experience about adenomyosis we call 3 steps. The first step is HIFU. The second step is GnRH, can also another medicine like gospel is a very interesting medicine. Also mifepristone is a very old one, and also the little bit new one, dinoprogesterone. The third step we will put Marina. So we call it the 3-step 三部曲. So this is a paper last year we published. So this is also our very best work of art. So we can see the huge uterus has miraculously regained its beautiful shape after non-invasive gentle ablation. The first picture compared to third one, so we will see the uterus shape already came to normal. So the first step is to clean the skin. So we have so many patients. We also do some very nice consultation. We will tell them this kind of beauty shop. The patient do this simple technique in some area in our city will spend 5,000 yuan renminbi. But in our center, it's free. The first step is clean the abdomen. The second step, we will evaluate the region of location and vascular supply of the lesion through MRI. It's just like GPS for driving. So we will see the lesions, the size. And the third step, we will use ultrasound guide HIFU. So we will find the very interesting area of adenomyosis and begin to sonicate. So we will see here. So the beautiful color here we call 灰度团块. The change usually happen at the beginning. So this is a case we done just recently. The first, second, the best coming. So through our research, we will find the VS score compare before and after HIFU treatment change dramatically. Here is the menstrual volume score compare before. So we can see after 3 months, 6 months, and 1 year, it can change very well. And the hemoglobin also can change to normal. And uterine volume compared to before and after HIFU treatment, we will see the uterine volume was completely come to normal. So very interesting thing, we found the CA125 can reduce after treatment. So we get the conclusion, the 3-step approach of HIFU, GnRH, or other medicine and the Mirena is a very lowest risk of treatment. It's safe, effective, and efficient. It can improve quality of life, especially for patients with localized adenomyosis. So here are some cases. The first case is also one of my friends. We can see the left side, the huge myoma after 1 day after ablation. So we will see the heart-shaped lesion. The 3-step, we will do hysteroscopy. So the purpose of hysteroscopy is to remove necrotic tissue. At the same time, there is pathological evidence to rule out cancer. At the beginning, when we had lecture about HIFU treatment, some of senior, a little bit elder doctors mentioned, you have no biopsy. So this is a very good method that can give us evidence to rule out the cancer. So on the right side of the picture, we will see after cleaning of uterine cavity, showing the very beautiful uterine. So we will do biopsy, we will see high-grade degeneration. Recently, we found another method for patients. So after the shape of the uterus coming to normal, we will do resection of endometrium. The first video about the resection of anterior wall. The second video for posterior resection of endometrium. So we will clean all endometrium. It's kind of source treatment. All we know, adenomyosis and endometriosis, the ectopic endometrium can transmit it to another area. So after the big uterus shrink to normal size, we will destroy the endometrium. It's very useful. This is a very new case, just happened recently. We have many adenomyosis, the patient denying sex without marriage. This kind of lady, they wouldn't like to do anything through vaginally. So HIFU is a very good technique to destroy the enemy. So the patient had very severe dysmenorrhea. Just after 1 month, everything disappeared, no pain. The third case is a very interesting case. We will see the very huge.
We lost you again, Professor Aili. We lost your voice again. We are still not hearing your voice. 听不到。 No, your voice is not breaking. Your voice is breaking.
In a hospital where internet is not so good.
哎呀，他们找找应该找一个比较好的地方嘛。
喂
Ronnie, maybe you can ask Prof. Aili to shut down her face or video. Just only her voice. Maybe it's getting better.
Okay, we try to. Okay, one suggestion from is to from my co-chairman says ask her to just shut down the slides, the vision, and just use the voice. See whether it's possible. This is a suggestion from Dr. Reddy.
And now I think she's done.
Okay, all right. I mean, yes, I saw what Nandi suggested. That's what Dr. Relly suggested. Only just the voice. Forget about the video. Okay. Unfortunately, we really miss Professor Aixingzi Aili. Never mind. Can we continue with the what has been left off and back to Dr. Raymond? I think Dr. Raymond was going to say something. I have to cut him off. Raymond, are you okay to continue what you've said? No, I can't hear you, Raymond. On your mic.
What I was going to say is when I did my initial training in China, I was in Chongqing and Swining for about 6 weeks. And then when I came back to South Africa, Chongqing provided me with excellent teachers who worked with me for 1 year until I was competent enough to be able to do it on my own. So I couldn't have done it without Chongqing support.
So you have somebody sitting next to you for almost a year.
Yeah.
Ooh.
I had 4 different doctors. Each one came for about 3 months at a time. We worked together, and after a year, when I was competent, they left me on my own.
Okay. All right. Okay. Hugo, you have anything else to ask, or ask anybody? Especially you want to ask. You were saying you're going to torture Dr. Olarik with your questions. Hugo, I can't hear you. Your mic.
Okay. Better?
Yes.
Yeah.
So, well, that's what I expected from Raymond, of course, because my very limited experience tells me without initial help during the 30, 41st cases, you cannot, it's impossible to do it. And I know South African patients that are disasters, those patients. So I'm very happy to hear how Raymond did that. Shall we now move to the presentation of Olarik, or?
Okay, no.
Any more questions to Raymond?
Okay, I don't know whether Dr. Riley has anything to ask the speakers.
Yeah.
Obviously, we lost Aixingzi Aili. And for that matter, I'm not sure whether Professor Gill has any questions to ask.
From Aili, is it already here or still lost?
No, I don't see him anymore. I don't know whether Friedrich is still there. Friedrich, where are you?
I think it's the topic of Prof. Aili is very important for us, especially for the adenomyosis and treatment by HIFU, because it's very, like Dr. Olarik said, that this very, very Yeah, we want to know the experience from Aili, how to handle, or maybe Raymond can give us experience how to treat the adenomyosis in your hospital. How is the suction rate, or maybe how is to solve the fertility problem?
We don't see a lot of adenomyosis in our black population. Of the
really,
yeah,
is that
we
true?
see a lot of it in the white population, but we don't see much in the black population. So we've treated, I think, only probably about 20 patients with adenomyosis, and the results we got were very good.
So Raymond, are you saying that adenomyosis in South Africa is much more, how should I say, relevant in the white population as in the black population?
Yeah, the same with endometriosis. We hardly see any endometriosis in our black population.
No, adenomyosis.
Yeah, no, but I'm saying both adenomyosis and endometriosis, mainly in the white population. We hardly see it at all in the black population, but then fibroids are extremely common in the black patient.
Yeah. Oh, I didn't know that. So that's interesting.
So we don't have much experience with adenomyosis. We've only treated about 20 patients with the adenomyosis.
Black patients.
Black patients.
May I share something?
Okay, sure.
Yeah, please. All right.
Yes. Okay, I think for the adenomyosis, it depends on the goal of the treatment. Okay, for the treatment for the pain or the abnormal bleeding, I think the HIFU is like a tool to like destroy the lesion. But after that, I agree with Dr. Aili to use some medical treatment to suppress and to protect the recurrence of the adenomyosis, because we know that if the patient has the estrogen, the disease can come back. So in my opinion, I don't have the experience on HIFU, but I think after treatment with the HIFU, we have to give some hormonal treatment lifelong until her menopause. This is my opinion for treatment of pain and abnormal bleeding. But for the patient who has the infertile, I think the treatment is big difference, because we try to get the pregnant is very early, as soon as possible. So I think the strategy is very different between two sides of the patient. This is my opinion.
Okay.
Yeah. Any more questions or comments?
Yeah. There's we have two questions from chat room.
Sure.
First from Victoria Rowena CC. She asked about the cost of the HIFU procedure for adenomyosis in Chongqing Hospital or in Singapore. Maybe Dr. Keen can answer the question, the cost.
Okay, sure. The cost of the treatment of adenomyosis and the patients, I think most of us have done in Singapore, usually is covered by their personal hospitalization insurance. So ballpark figure, anything for a short procedure, a simple adenomyosis, to somebody who has to do it for 3 hours and all this, varies from, let me see, I have to think in terms of Singapore dollars and convert. Okay, it is something like US 15,000 to US 25,000 ballpark figure. Really depends, all in ballpark figure, including MRIs and blood tests and all. But you must understand, even an MRI in Singapore costs about US $900. And I understand in Chongqing, they can do MRIs before the procedure, immediately after the procedure, and then 3 months, 6 months, 9 months, and a year. But we can't afford to do MRI for follow-ups. That comes to the question especially I'm going to ask Raymond, do you use MRI for follow-up? Because After that, I normally just do one MRI for patients who can afford, and I just follow up with just pelvic ultrasound.
So we do one post-treatment MRI at about 6 months. We've only got one MRI machine for the entire hospital.
Okay. What about ultrasound? Ultrasound follow-ups? Do you do that?
Well, we do ultrasound follow-up. So we do ultrasound at 1 month, 3 months, 6 months, 12 months, and 24 months.
Sure. That leads me to what I have always been thinking. Why don't we use 3D ultrasounds like what we use for babies, pregnancies and all this? Why are we using 2D ultrasound? So this is a question I'd like to pose to everybody. Has anybody thought of using a 3D ultrasound for follow-up? Okay, if not, then is there another question?
Yeah, I think Professor Aili has already joined with us now. Professor Aili, can you hear us?
Professor Aili, Aixingzi, 你可以听到吗? No response from her, I think. Yeah, there's no response.
The connection from hospital is...
while the rest are thinking of the questions, can I just continue presentation for a while where everybody can actually write in or raise a hand because Rally has better eyesight than I have. Can I go back to the slides?
Dr. Kim, there is another question also from that room.
Can you read the question?
Yeah. From from Vishnu Sharyawan, I think it's from Indonesia.
Mm-hmm.
He asked about what happened with the ablated tissue. I saw they created a space hollow in the uterus. It can be resolved spontaneously over time. Yes.
Unfortunately, Aixingzi Aili is not with us. I don't know. I'm not sure whether she can hear your question.
Yeah. And another question is there any contraindication for HIFU procedure? From the same questioner. Maybe you can answer the question, Dr.
Okay, sure. I just saw my teacher Zhang Lian on the line, and I think Raymond can answer that too. So maybe Zhang Lian, you try to answer the question first, and then we come back to Raymond. Then I'll give my 2 cents worth. Zhang Lian, have anything to say?
Yeah, I'm here. Yes. So yeah, about the complications, HIFU treatment right now at this moment, I think is really safe. So the complication rate is very low. So the most common complication is about the skin burn. So when the patient had like the previous surgery and the abdominal scar, so then for this kind of patients may have a higher risk to get the skin burn. So during the treatment, so we can we have the protocol. Like for example, when we solicate for 50 seconds, then we have decrease a transducer and slow down and check the skin. Then we do it again. So for this follow this kind of protocol. It's like the skin burn, the rate is like the 0.1%, something like that way. So now it's very safe about this.
Okay, Raymond, you have anything to add to that?
Yeah, just adding on to what Leanne said. I mean, that's why it's done under conscious sedation. The patients will warn us if the skin is getting hot. So we will then take precautions, and that's how we prevent it. So if they tell us the skin's getting hot, we'll lower the transducer, we'll stop treatment, we let the cold water come into contact with the abdominal wall. When the skin cools down, we will continue again.
刚才我登录进去，能听到我声音吗？
目前
and in terms of complications, injury to bowel or other structures, we make sure when we're treating that we leave a margin of about 1 centimeter from the edge of the fibroid to allow for dissipation of heat. And therefore, because it's such targeted treatment, it's a very safe procedure. We have very low complication rates.
Well, let's come back to my learning curve. So, and that's why I always emphasize.
May I ask something, Professor Lee?
Yes.
Raymond, you say your complication rate is very low. Are you sure that the patients with complications are coming to you? Because you have patients from all over South Africa. They come to you, you treat them, and they disappear again in their villages. So if you have then complications later, how high is your loss to follow up for your patients?
We have got a problem. I mean? Yeah, no, for sure. Yeah. Plus, we have patients coming from across the borders as well. Yeah. But we probably, patients that are coming from out of our Johannesburg area is probably about 10%. But what we do is when we discharge the patients, we give them a letter to their doctors, please to inform us that if there are complications, they'll let us know. But we do have a bad follow-up with some of our patients.
Yeah.
But we probably, maybe we do lose some to follow up.
Yeah.
But of the ones that we see, the vast majority, over 90%, come back for follow-up. And there we know the only real problems we've had are 2 cases of superficial skin burns.
Oh, okay. That's great. Yeah.
Okay, I think,
thank you.
Professor Aixingzi, Aili is back online. Aixingzi, did you down, huh?
Yes, I'm back again. I'm very sorry, terribly sorry.
That's a question for you. Dr. Raleigh, can you ask the question again on the resection?
Yeah.
I lost that.
Okay, thank you, Prof. Aili. There is some question from the chat room. How is the adverse effect on implantation after HIFU from your experience, implantation rate?
Actually, I'm busy typing the words to the message, and also Professor Zhang Lian answered this question. So mostly 2 side effects. One is bowel injury. We happened one at the first year. The second is skin injury. Am I right, Professor Zhang Lian? Two sides, yes? 2 aspects. One is bowel, skin, but it's happened very rare. If you had a very good procedure, keep the good reason like music or dancing, not to hurry, be careful. It will not happen forever, I hope.
How about for the implantation rate after the HIFU for the infertility?
Nearly at least 70%.
Okay.
Ooh. Okay, there's another question here from the chat room from Dr. Melinda Rita. Question is HIFU appropriate for a 47-year-old with adenomyosis and a 6 cm funded adenomyoma? A patient doesn't want surgery.
That is a very popular situation. So many women, sometimes psychologically, the woman's heart is very hard to understand. So there is a very old saying in China, woman's heart like a undersea needle, Professor Lee, 女人心海底针. So mostly the woman wouldn't like accept surgery. So we have so many excellent surgeons. They can do the laparoscopically or types of surgeon very well. But mostly the woman wouldn't like accept any surgeon. They wouldn't like had any incision on the abdomen. So we have some actors and some 空姐怎么说的来着？张丽老师，我一下给忽然撒的里方。We have some models. They wouldn't like had any injury. So HIFU is a very good choice. No any incision, no bleeding, non-invasive, very gentle. The patient can talk with you. You can the patients can see some video, listening some music, so you can destroy the lesion very quickly sometimes.
Okay, there's another question asked whether is HIFU suitable for diffuse adenomyosis?
Beg pardon?
Is HIFU suitable for the patient with diffuse adenomyosis?
Very suitable. Unfortunately, I prepare very good case on my slide, so I'm not very sure what's happened on my computer. So it's very good for diffuse. It's like electrical curve can ablate all the lesion.
But you must understand, Professor Aili, you know, when we do HIFU for adenomyosis or even for fibroids, we are supposed to leave a corridor of safety from the serosal layer of 1.5 centimeters. So if it's diffuse, how are you going to treat the adenomyosis that has reached the border of the uterus?
Yeah, we can treat the areas, the safety area we can treat, and after HIFU, we can use medicine to control the menstruation. So sometimes for very hard case, the choice is the menstruation and the uterus. So if you want to keep the uterus, just stop menstruation. So we call adenomyosis and the endometriosis like pelvic vampire. No bleeding, no menstruation, the disease can be stopped. So after HIFU, we can use some gospel, like I mentioned in my slide, unfortunately. So this kind of medicine, gospel, 棉酚, it's very magic medicine, can stop the woman's menstruation. So stop the menstruation, no pain. The uterus can be relieved. So whatever, what kind of big, huge lesion, it can be healed.
May I have ask some questions?
Okay, Olarik. Sorry,
Yes.
I just see your message. Wow,
Okay.
I'm busy for my slide. I can't have time to check message. You send message. I just see. Thank you so much.
Do you think for the pre-treatment, I mean, give a GNIS agonist
Yes.
for HIFU? Is it easier to do HIFU because maybe the uterus is smaller? What do you think, in your opinion?
Yeah, that is very good question. At the beginning, especially for the very diffusion, big, huge adenomyosis, we use the GnRH 3 months, and then we do HIFU. But literally, we found it's not very good. So now we use after HIFU. The size of the adenomyosis, the more bigger is more safer for the patient, especially combined with DIE. Because very dangerous back posterior part of the uterus.
Okay. All right. Can I just take a moment off, go back to the slides, since everybody is talking about pregnancies, and I show you. Can I share with you the? Okay. Well, for those of you who wants to know what is the pregnancy rate like, this is taken from Chongqing. Already 1,500 HIFU babies, normal course of pregnancy, no incidence of uterine rupture. And I'm also very happy to announce in Singapore, well, my colleague, Dr. Hong and the rest of the team went to visit Chongqing HIFU Hospital and in 2018, and very glad to announce that Dr. Hong has successfully treated a lady with fibroids, and the lady is now a proud mother of a beautiful baby just 1 or 2 months ago, and that's Dr. Hong with the baby. So for anybody with any doubts about the effectiveness of HIFU and the complications of pregnancies, I really don't think so, because HIFU itself hasn't got a cut on the uterus. Let me continue. I'm very glad that Professor Wang Zibiao actually visited the HIFU Center in Farrer Park Hospital last year. I'm glad to host him and to show him what we have done for the hospital. And I have a heart-to-heart talk with him, and probably the first time I have the opportunity to talk to him about his experience with HIFU. You see, it is not the usual wine and dinner talk. I really grilled him, and it was the pouring from his heart of his trials and tribulations of his research, experiments, and commitment to HIFU. So if you walk around the compound of the HIFU hospital in Chongqing, you will notice there's a monument erected in honor or in remembrance of a HIFU pig dated 15th of August, 1997. So I would like you to hear a pre-recorded video, which he has specially prepared for us. When I asked him, please tell me the story of the HIFU pig. And with eyes full of excitement like a child, Professor Wang Zibiao told me this story. And you will understand it's a man with great commitment to medical science in search of an answer to alleviate the sickness of mankind. He sacrificed his youth buried in his laboratory with his team in pursuit of a belief that ultrasound energy is the next big thing in medicine. If he failed, he's a forgotten fool. But he succeeded, yet he kept his humble silence in one corner of China. He's a rare breed of great achievers to be admired, a one in a million. So I will show you the video he has specially prepared. Let me just click on this.
这个今天呢，我们在远程室看到这些图画，实际上全是数字化治疗，所以我们可以远程化。今天呢，这个很高兴国际部这个有关这个由我们新加坡的李建威医生来主持的这个会议，我很开心。那么在这个会议这个中间呢，我来讲一讲这个海弗猪的故事。其实海弗猪呢，就是我们在研究这个聚焦超声呢，真正切肿瘤的一个刀尖呢，不是生学的刀尖，是生物学交域，是要在组织里面形成灵魂坏死点。这个坏死点随着刀头的移动，这个坏死点在移动，看到没有？这个概念所以叫生物学交域。而这个工作到今天为止，我敢跟大家，我们做了30来年把这个问题解释清楚了。但是在解释这个问题上，以前呢，我们都是靠只要做一个焦点，觉得我们聚焦超声就可以切肿瘤。实际上我们走过了非常艰辛的路。早期在这个组织里面，不是我们这个聚焦超声就可以形成灵魂坏死点，是我们做可能有时候出现，有时候不出现，而且大量的不出现。那怎么来解决这个问题？我们实际上在经过了好几年的实验以后，突然有一天呢，这头猪我们做的小型香猪，我们聚焦在肝脏里面的20个点，每个点都出现了灵魂坏死，一种理想的完美的这个展示了刀尖的效果，每一个点都看到非常好的灵魂坏死点，边界很清晰，大小可控，简直这个我们觉得是上帝的安排。上帝因为我们的千辛万苦感动了上帝，所以上帝给我们回报了，给我们体现了这个结果。那么这头猪是我们历史的转折，所以我们把它叫做海弗猪。那天我们一般猪做了实验以后解剖了，我们会把它还到我们的动物这个实验中心去。那天这头猪我们就没有，我们大家跟这头猪我们给它敬礼，给它默哀，因为它对人类医学，特别是聚焦超声治疗 是做出了巨大的贡献，而这个不是对我们团队的贡献，是对人类医学的贡献。所以我们给他竖了一块碑，然后我们上面就叫海福珠，这个概念就是这样来的。所以因为海福是海福这个团队，实际上真正的从专业上应该是对聚焦超声高强度聚焦超声这个消融手术做出卓越贡献的猪。
Okay, how do I get back?
这个今天呢，我们在远程。
Okay, then no, this is the next. Next one. Okay, sure. Then I went to ask him about how do you start on your first patients because China was just opening up, and because of the strict laws and regulations, it was very difficult to conduct trials on patients. So it was as last resort that his first few patients with bone cancer approached his HIFU team for help. Now, we know it as HIFU. In China, they call it FUAS, Focused Ultrasound Ablation Surgery. These patients were resigned to face death, then to be amputated. Thus, under such sad circumstances, Professor Wang and team agreed to treat them with HIFU. Now you watch the video and observe the moving emotion of a great doctor, his inner feelings, and his gratitude to his patients.
第一例骨肿瘤，第二例骨肿瘤，甚至后面的骨肿瘤，我觉得这不是我们事先想到的。正好他们的家属、他们的父母亲说，患了骨肿瘤，最后到全中国这些医院跑下来说，只有截肢，而且截肢以后存活多久不知道，因为我们知道恶性骨肿瘤实际上我们一旦诊断，80%甚至90%已经有远处转移，所以在这种背景下，这个父母不愿意孩子把这条肢体接了，能仅仅活几个月。他们希望的是，如果能够治疗能够保质，哪怕最后他走了，他是一个完整的人。这在中国的我们叫世俗的观念，是希望孩子是一个完整的，不管生命能不能保得住。所以在这种情况下，全世界在聚焦超声治疗恶性肿瘤里面没有先例，是不是？临床治疗哈，这个方面，骨肿瘤就是我们全世界的聚焦超声消融手术的第一例。那么在这种背景下，我们确实取得了成功，因为我们聚焦超声的生物学教育不仅仅是我们以前靠猪靠生物学实验、动物实验室切出来看，而在我们第一例、第二例的骨肿瘤里面，我们一聚焦，啪，这个点呢，焦点的地方在 B 超的灰度上，啪就亮出来了。后来我们总结发现，骨肿瘤是最好的聚焦超声治疗的这个疾病适应症。为什么？因为骨肿瘤里面，特别是我们是成骨肉瘤，它里面有这个骨的成分，可以把超声波的机械波转化成热能，所以很容易看到它的这个强回声的，就是灰阶的巨大的变化。那给了我们全世界这不是给我们信心，是给了全世界这个领域的信心。那么很感谢那些都是孩子，我们有的孩子我们延长了生存期，有的孩子今天哪怕20年以后的今天还活着，而活着的孩子他的肢体是完整的，所以我们怎么说呢？这个技术哪怕有时候看到一个孩子20年前可能我们是要高位截肢，甚至能不能保命我们不知道，而今天他不但保了命，而还是完好的一个人，他没有残疾，他的肢体是好的，还长在那儿，还保留在那儿的时候，我们开心。所以我感恩这些孩子对人类医学的贡献，也非常的感恩 我们这个医疗团队让这项技术在这个第一个实验证里面取得了成功，所以第一例、第二例的贡献对这个领域可以说是里程碑式的贡献。
Okay, thank you very much, Professor Wang, and on behalf of the cancer patients, really a big thank you. Let's come back to question and answers. Really, can you read? I need your good eyesight. Okay, that's a question from, I think Raleigh asked the question himself. Every adenomyosis patient always receive combination medical treatment, even for patients who wants to be pregnant. I think this is question from Dr. Raleigh to Professor Aixingzi. Aixingzi, 你还在听到我们吗? Okay, well, Dr. Samsu Hadif has a question. He raised his hand. Please.
I would like to ask how the recurrence rate, and if the adenomyosis with infertility, how long we can wait for becoming pregnant spontaneously or by IVF? Thank you.
Sure. I think this question we'll leave it to Aixingzi. Aixingzi, are you still online? I really cannot answer with confidence.
Look, Aili.
Aili, are you online?
I think I can give the answer.
Okay.
Yeah. Generally, we always, if the patient won't have the plan to get a baby in the future, so when we treat this patient with with adenomyosis, we have to protect endometrium. So the lung perfused volume ratio is around 50%. So after that, we just suggest them wait for 6 months to get conceived. So generally 6 months after have treatment for pregnancy.
How about the recurrence rate, Prof. Chan? Recurrence rate of adenomyosis after HIFU?
Yeah, it depends the classification. For example, like based on the MRI, if this patient with, for example, type 1, like say intrinsic adenomyosis, if they don't want to if they already complete the childbearing, for this kind of patients, we can completely ablate the adenomyotic lesion. For this type, the recurrence rate is lower, but we don't have the number for the total patients. Generally, like our paper already for the 2 years, complete 2 years follow-up. So the symptom improvements, symptom relief at the end of 2 years, like around 80%. It means like the 20% may have the symptoms come back after 2 years. Is that your question, right?
Yeah.
Okay. So right now, I think also we're working on this for the different type, use different protocol to treat. So in the future, I think probably next year we are going to present the results for you guys.
Okay, I think Dr. Samsu Hadi still has a question to ask. Dr.
If there is a recurrence, can I do HIFU for the second time?
Yes, for sure. Yeah, because it's a non-invasive. So like I already showed, probably Dr. Lee already knew my first case. The case I treated 10 years ago. So after the treatment, symptoms disappeared. So 2 years later, she had the symptoms come back again. Then we perform the second session of HIFU treatment, then get very good results with any complications. So because it is non-invasive for adenomyosis, we can treat it for the second time or third time even.
Okay, Professor Aixingzi just type her reply and say that after HIFU treatment, normal vaginal delivery is fine. It's okay. Are you back on, Professor Aixingzi? Can you say something?
Yes.
Okay, can you add to that? Because they're wondering whether after HIFU treatment for adenomyosis, can they get pregnant soon? And secondly, can they have a normal delivery?
Yeah, Professor Zhang Lian answered very well. Actually, I already answered on the WeChat, the platform. So it can pregnant easily. I mentioned I have a 45 years old patient. After HIFU, she pregnant 2 times. When she come to me next year, she opened the door and said, "Oh, it's easily to get pregnant. Side effect for HIFU." So she mentioned easy pregnant is one of the side effects. So we have some of patients after 40 years, they have no any plan to have a child again, but after treatment, all of them pregnant. It's like a little bit not very good because I against abortion in China. So we will do good protection to stop the pregnant for some of patients. So not a problem for HIFU patient after 3 months or 6 months. Professor Zhang Lian already answered the question.
Okay.
陈老师，你能听到我说话吗？我突然觉得我这个电脑有点毛病，一会儿好，一会儿不好，让我好尴尬呀。
非常好，非常好，现在很好。
Prof. Aili.
我太对不起那个 Professor Lee，I'm so sorry.
No, it's okay.
Yes, I'm not actually.
Oh, I lost you again.
Oh yeah, it's very hard.
Maybe it's the weather. 天气的关系而已。Okay, anybody has any other questions? Because I can't see any burning questions. Please ask. If not, then we go on to, well, let me see the chat.
No.
Prof. Lee?
Hi, yes.
Prof.
Yes.
Lee, I have to go. I have to go to theater, so I'm going to have to leave.
Raymond, thank you so much for joining us. Thank you so much.
Thank you for having me, and thank you for inviting me to speak.
Oh, don't forget
Bye, Raymond.
South Africa.
Thank you, Raymond.
See you in Soweto, Raymond.
Absolutely.
Come to see you.
All
Looking
right.
forward to seeing you.
Yeah. Goedenavond.
李教授，李清荣教授，你是不是要
？Yes. Okay. Thank you for Thank you for very good chairman. The moderator these sessions, and also thanks for the Professor Wang Zibiao to have present the so wonderful the HIFU peak and also the bone cancer in treatment by HIFU, and is so impressed. And I have one question for Professor Zhang Lian, because in the if we concern about the same size of the adenomyosis and myoma uteri in the same size, for example, maybe 5 centimeters, the same size. But how about the treatment operation time? Is there compatible between the treating adenomyosis or myoma uteri, or they are quite different? Because as we know, when we treating the adenomyosis, the patient will feel hurt quite a lot. So maybe we will slow down our procedure and our voltages in the treating. So how about did you have any paper or any data showing about the operation time between the adenomyosis and the patient with the myoma when you treat them, and when which will be more quick and maybe more convenient for the doctor in treatment?
Yes. Dr. Lee, Professor Lee?
Yes.
Yeah, yes, a very good question. Like I discussed with you before, for my it's much easier for us to evaluate based on MRI to know which one is more easier, how long it's going to take to ablate the tumor. But for adenomyosis, it's much more complicated about this. But anyway, right now I think based on MRI, for example, like the intrinsic adenomyosis, also it's more easier. It's more easier, and also based on the MRI, we can say, like the hypo intensity on T2, and also we didn't, if we don't say any like the on T2 we didn't say the like the sex or something like that. For this type is also easier. So I mean, MRI is also help us a lot. But I mean, probably next year I think we can show our data about the adenomyosis different type, how long it's going to take for the HIFU treatment. The solution time, even like something like that.
Okay, thanks a lot. Yeah,
we can do.
Yeah,
to show you guys.
Yeah, thank you. We learn a lot.
My students, right on.
Yes, yes.
Okay.
I think we learn a lot from the Professor Zhang Lian. Thank you for your comment. Yeah.
Professor Zhang.
Yes.
Have you performed Doppler blood flow to the uterine, to the uterus before and after your treatment for adenomyosis?
If the patient they don't have the plan to conceive, then we can do this. Yeah, put this in there. After HIFU treatment, we can get this device, put the device in there. Yeah.
No. This is not a device. This is the Doppler ultrasound for blood flow. The blood flow to the uterus.
I'm sorry.
Have you measured their blood flow? Is it better? Does it improve?
Yes, the Doppler ultrasound. Yes, before and during or after, we can use a Doppler ultrasound to check the blood flow. Yes. It works. It's helpful.
It works, yeah. It improves a lot.
Yes.
Yeah.
Mm-hmm.
Thank you.
Thank you.
I suppose the final verdict, especially for those ones who are pregnant, is whether they get pregnant or not, whether the Doppler blood flow has improved or not. Basically, what they want to the patient is pregnancy. Are there any questions? If not, then I show a few slides before I end the session. Just give me a moment. Okay, are there any more question answers before I conclude my the last episode? Okay, all right, I've done that. Okay, for those of you looking out for summary episodes 2, 3, and 4, which I normally do that, but unfortunately because of the time and I'm still waiting for answers from some of the previous speakers. So maybe just watch this space in the next episode, if ever we have a next episode. But I think we will because of the interest generated, especially on adenomyosis. Just a question that somebody asked me long ago, will HIFU replace open and minimally invasive surgery? My answer is no, for many good reasons, because Not every fibroid is the same. Not every mind of women are the same. Okay, in my opinion, the preservation of femininity and fertility, HIFU is an excellent alternative treatment for fibroids and adenomyosis. We know that right now in the world, it is often late marriage because of career, because of the education. But if women ask for ovarian or egg freezing, have you ever thought of women may ask for preservation of the uterus for whatever reasons? That is food for thought. If I show you this picture of a scholar, then if I look to the right, you can see camels and horses, looks like a traveler. And if I show you the next picture, you will know that I'm talking about Marco Polo from the 1254 to 1324 AD. And what this traveler has done, Marco Polo, he started off in Italy, Italy, Venetia, and all the way Venice, and all the way to the east to Mongolia and China. He has the land road, the Silk Road, and he has also a maritime road. Now, what is the relevance of this map to us today? This is the beautiful part of the Silk Road. You can see sand dunes, camels, and animals accustomed to desert. You can see very hardworking people, Chinese people from the Muslim side of China, and beautiful buildings, palaces, and an oasis, and also mountains with different colors. This is the beauty of the Silk Road. Well, Marco Polo came to offer his knowledge and culture to the Orient. With warmth and love, he was respectfully accepted and returned to Europe, bringing with him the riches of trade, peace, and Oriental culture. How does it relate to present day in the world? Well, we would like to welcome more Marco Polos to help us spread the good. And when I was a child, I loved this fairy tale called Journey to the West, the folklore. And this is to me like what is Harry Potter to my grandchildren now, but I think I'm still 一个长不大的孩子. Now, from folklore to a modern day reality, and who says dreams do not come true? And when it comes true, it's God's gift of renewal of love, friendship, and brotherhood. Let's cherish it in good faith with peace and the exchange of knowledge and kindness. This is very similar. What we know today as one belt, one road, and one heart. A similar Silk Road and a similar maritime road. So let us continue the journey of progress for mankind. 就是说，在跑这条路会遇到很多妖魔鬼怪，但是我们不管了，只是用一条线去进步我们所需要的、所需求的为人类。And I think, as doctors and nurses and caregivers, share the knowledge, spread the goodwill, cast aside all the man-made hurdles. Together we bring peace, love, and health without borders to our world. And I hope together we can have the sound of HIFU to be the music of health for everybody. And my last slides, I would like to reiterate, HIFU is not arcade games, not a bowl of water with ultrasound. It is acquiring a smart virtual therapeutic system that comes with research, teaching, learning, and management. It is a whole new world of surgery that demands our undivided attention, that is focus, judgment, skill, discipline, and discipline. So before I say goodbye to all my friends and to all the chairpersons, panelists, speakers, and audience, really you have given me face. 你真的很赏脸 my jump cake. I also need to say thank you to the wonderful team to help me. Most of them are based in Chongqing, and there's Tony based with me in Singapore. There's JPU who helps out every now and then, even middle of the night, to arrange the slides. And this is the Ping, the big man in charge of Europe, and his sidekick, good assistant Nathaniel. And of course, Professor Rosie Singh, who is still orbiting around the world. I don't know which satellite she is in now. And the very, very important superwoman, Jenny, who helps out with everything. And she's really my walking encyclopedia. And a big thank you to the team. And a big thank you to Jenny and for me disturbing you throughout the day and night, even on Sundays. And a special thank you to Dr. Wang Qian, my great teacher, who's very, very patient with me as senior citizens and very forgetful, but she'll repeat again and again and teach me to all the protocols and all the guidelines, never failing and never angry with me. If I have another son, I don't have any more sons to get a daughter-in-law, otherwise she my target. And of course, to my wonderful staff nurse, Sister Iris, to arrange for all the preparation for the HIFU patients and taking all my nonsense. Very big thank you. I never have a chance to say thank you to her. So this is a time to say thank you to her. And my wonderful company, all these are my bosses. We have obstetricians and gynecologists, we have pediatricians, we have cancer-related specialists, and we have dermatologists. And this is handled by Mr. Eric Chu, my CEO, and Dr. Bei Suantiong Ma Yishen is the executive chairman. And I think it's time for me to drink my coffee. It's cold now, and I think dinner is also waiting. Thank you so much. And this is something which, in my travels to China, I noticed this. And I'm Dr. Lee from Singapore ONG. A big thank you to all of you for having me, and bye for now. Thank you so much, all the speakers. Thank you so much, Zhang Lian, my Lao Sư, and thank you, everybody. That's my last slide, and I think it's time for us all to either go home or go and have our dinner. Thank you very much.
Thank you, Dr. Lee.
Thank you. ขอบคุณครับ
Thank you, Dr. Lee.
สวัสดีครับ
See you.